Listening C is often thought of as one of the most difficult parts of the listening paper, but are you using the right strategies? Hi, I'm Jo from Specialist Language Courses. We are OET premium preparation providers, which means you are in the right place for your OET. Don't forget to subscribe to our YouTube channel and hit that bell so you're notified every time we post a new video. Let's get started with Listening C. There are 3 parts to the listening test, and in this video we're going to take a closer look at Listening C. In Part C, there are 2 long presentations or interviews, and each extract will feature a healthcare professional talking about an aspect of their work. There are 12 questions, 6 for each extract, and each one is a 3-option multiple-choice question. The context of the conversation will always be provided. Here's an example. There are questions to guide you and 3 possible answers. For each question, you mark your answer by colouring in the circle. And for Listening C, you will need to understand large parts of the audio. So what do you need to do in order to pass Listening C? Let's take a look at the strategies you need to use. Before listening to each extract, you have 90 seconds. It's so important to take advantage of this time by looking at the context provided so you can begin predicting what you may hear. Then notice the structure of the audio and understand the questions. Read the options and notice the differences between them. Let's take a look at an example. We can see the keywords here in the questions. Why indicates we need to listen for a reason, and we need to focus on the reason given for male breast cancer, possibly as compared to female breast cancer, in terms of it not being given too much importance. If we look at the options, A deals with diagnosis. For this answer to fully answer the question, it would have to give information about late diagnosis contributing to male breast cancer being a neglected disease. Option B addresses how uncommon the disease is, resulting in it not being studied sufficiently. For this option to fully answer the question, it would have to give information about how rare or uncommon and lack of studies contribute to male breast cancer being a neglected disease. And option C states that older male patients with breast cancer are not treated with importance. So for this option to fully answer the question, it would have to give information about a lack of care or importance given to male breast cancer patients, contributing to it being a neglected disease. Let's listen to the audio and choose the answer that best fits.
Today we're talking to Paula Weston from Breast Cancer Network about male cancer. Paula, why is male breast cancer referred to as a neglected disease?
Breast cancer in men is much less common than in women and remains an understudied illness. If we compare the statistics, it is easy to understand why there are fewer cases of male breast cancer to research. For example, the estimated risk of a man being diagnosed with breast cancer before the age of 85 is around 1 in 715, while the risk of a woman being diagnosed with breast cancer before the age of 85 is around 1 in 8. Each year, tens of thousands of new breast cancer cases are diagnosed, of which about 140 cases are of male breast cancer. Much of the information we have about male breast cancer comes from our understanding of female breast cancer, although it is clear that men react differently from women to a diagnosis of breast cancer.
And the correct option is B. Answer B states that it is sometimes regarded as a neglected disease because it's not sufficiently studied as it is uncommon. We can see in the audio that breast cancer in men is much less common than in women and remains an understudied illness. It's then supported by statistics comparing the incidence of cancer in men compared to women, highlighting how uncommon it is in men. It is then restated by confirming that the understanding of male breast cancer comes from the information about female breast cancer. Option A is incorrect because we see that the audio talks about the estimated risk of a man being diagnosed with breast cancer before the age of 85, but it does not mention in the audio at what stage of the disease they are diagnosed. And C is incorrect as it is not mentioned in the audio. The audio does not talk about older men with breast cancer being neglected. Let's look at another example. First, we need to understand the question. You need to listen for what Ms. Weston focuses on in terms of breast cancer research. A states that Ms. Weston says the research is mainly about female breast cancer. B states there is not enough research being done. And C states that research does not focus on psychological areas. The correct answer will be which option Ms. Weston points out, focuses on, or highlights the most. So listen and choose the correct option now.
What is the scope of the male breast cancer problem?
I suppose it depends what you're talking about. If you are looking at the incidence of male breast cancer compared to female breast cancer, you are looking at quite small numbers. Male breast cancer is not in the top 20 cancers for men. Some studies suggest that male breast cancer survival rates are poorer than female breast cancer survival rates, but it can be difficult to judge. As I mentioned before, men tend to develop breast cancer at an older age, but they also tend to present themselves at their GPs at a later stage of the disease. Being aware of breast symptoms is another issue, especially for men who have not been targeted in breast cancer awareness campaigns, for obvious reasons. I mean, because the cancer is relatively uncommon in men.
What do we know about?
And the correct option is A. A says that it's predominantly about female breast cancer research. Ms. Weston states that the incidence of male breast cancer is low in comparison to female breast cancer, and it's not in the top 20 cancers for men. She then goes on to talk about survival rates, but states that it's hard to judge due to other factors. Therefore, the answer is implied as the lack of research for male breast cancer is because it's more commonly about female breast cancer. B is incorrect, as it says there is not enough research being done. And in the audio, we can see it says some studies suggest that male survival rates are poorer. And it goes on to talk about other factors such as seeking medical advice at a later stage and awareness, but it does not state that not enough research is being done. And C is incorrect. Research is mentioned in the audio, but no mention of psychological factors, so therefore C is incorrect. So how can you prepare for Listening C? Let's take a look at some things you can do in your self-study. It's important to practice listening to longer talks and train your brain to stay focused. Use TED Med Talks or podcasts such as BBC Inside Health. Practice listening to longer talks and train your brain to stay focused. Listen to a variety of audios on healthcare topics. Listen out for the speaker's attitude and opinion, and practice dealing with unfamiliar content and vocabulary. Let's take a look at some activities you can try with things like TED Med Talks. While you are listening, pause the talk every so often and summarize what you've heard. Then predict what you think you're going to hear next. Another useful practice is structuring and sequencing. So note down the main structure of the talk, then listen and take notes. It can be helpful to watch it another time to compare your notes and see if there's anything that you've missed. You can then make a note of any expressions they use to organize their speech and move from one topic to another. You can also improve your vocabulary by noting down any unfamiliar words. It's a good idea to try and guess the meaning from the context before looking at the words and seeing if you were correct. Then write some example sentences using the new words. So my top tips for Listening Part C. Stay focused. Read the questions before you listen. Use the cues provided in the question and underline the key words. So, I'd like you to listen to the audios we've looked at in today's video and find some new words and phrases. Let me know what they are in the comments below. And if you like this video, please like and share with your friends and colleagues so we can help more people achieve success in the OET exam. See you in the next video. Bye! Let's take a look at what you should do. Hi, I'm Jo from Specialist Language Courses. We are OET... I licked my lips. Don't forget to subscribe to our YouTube channel and hit that bell so you are notified. Oh my goodness. Let me tell you a few tasks you can use with things like TED Talks.